Daar bent u weer. Dat was wel weer genoeg pauze. We zijn klaar voor het laatste deel van deze dag. Ik hoop dat die dag al inspirerend was voor u. Samen met de Safety Dancers. Misschien hebt u wel nieuwe mensen ontmoet, oude bekenden tegengekomen, allemaal aan de netwerktafels. We gaan deze editie van het Vlaams Congres Verkeersveiligheid afsluiten met een korte slotshow met 2 keynote-sprekers. Zometeen is dat de voorzitter van het Vlaams Forum Verkeersveiligheid, de gouverneur van de provincie Antwerpen, Cathy Berx. Maar eerst is het de beurt aan Nhan Tran. Hij is afdelingshoofd Safety and Mobility bij de WHO, de World Health Organization, zeg gerust de Wereldgezondheidsorganisatie. En die hebben we wel heel goed leren kennen, liever dan we wilden de voorbije 2 jaar. Hij zal via een live-verbinding meer vertellen over de wereldwijde aanpak van nee, niet corona, de verkeersveiligheid, want daarvoor zitten we hier met de Vision Zero en de Stockholm Declaration. En die presentatie zal in het Engels gebeuren, dus spits dubbel uw oren. The floor is yours, Nhan Tran.
Thank you so much, and thank you for the very kind invitation to participate in this event, and a very good afternoon to everyone involved. And I'd like to talk a little bit about the current state of global health and global road safety in terms of the resolutions that have been adopted and the current political situation. And what I'd like to do is actually use this as an opportunity to talk specifically about some of the challenges that we are facing, and to introduce the idea of systems thinking as a means of achieving the global targets that have been established. So as many of you know, last year in 2020 and in Stockholm, Sweden, there was the 3rd Ministerial Conference on Road Safety, which was actually one of the last events that we actually were able to hold in person prior to the COVID pandemic. And following this event, in August of 2020, the United Nations General Assembly adopted a resolution on improving global road safety. And this resolution did 3 things. 1, it proclaimed the decade of action for road safety between 2021 and 2030. This is essentially the 2nd decade of action for road safety. Secondly, it extended the target to reduce deaths and serious injuries by 50% by the year 2030. And thirdly, it mandated the World Health Organization, in addition to the UN regional commissions, in collaboration with the UN Road Safety Collaboration and other partners, to develop a global plan of action to guide member states towards achieving the reduction of a 50% target in the number of deaths and injuries. This plan really calls upon all countries to act, and it emphasizes that action is possible, and it's really intended to inspire and guide countries to develop national and local plans that are adapted to local contexts. And this plan is widely available on the website. And I'm not actually going to go into the details of the plan, because what I want to do today is actually to talk about some of the specific implementation challenges. A lot of what has been described in the plan has already been made available elsewhere. But what I believe is missing from this is a more strategic focus on implementation and a specific focus on the use of systems thinking in order to overcome some of these implementation barriers. And that's really what I want to focus on this afternoon. What I'd like to do is actually to take a step back and to look a bit at the evolution of road safety and the systems thinking within the context of road safety. I'd like to propose to you ways of using systems thinking as a means of understanding causality and interaction within transport systems, and actually apply systems thinking to design interventions and to engage relevant actors as a means of actually achieving the 50% reduction that has been called for in the UN General Assembly resolution, as well as the Stockholm Declaration that was released 2 years ago. Again, this is not new data. All of you have already seen these figures and these statistics. 1.3 million people die annually. 50 million people are injured. It is, and it continues to be, the #1 cause of death for children and young adults 5 and 29 years of age. And this is really an interesting point, because this is the one area where all countries, irrespective of income status, share a common burden. So it is very true for countries in the Netherlands. It is very true for Belgium, as well as it's true for other countries, Bangladesh, China. Children die because of road traffic crashes. And of course, as you know, it is the 12th leading cause of death for all ages. So it's a big problem, and we've been talking about it a lot. It's a problem that has been around for a very long time. This picture here is a picture of Bridget Driscoll. Some of you probably have already seen her. This is a photo of her. She's known because she's the first recorded case of a road traffic death that took place in 1896. And of course, at that time, these were considered accidents. And you know that we've moved away from labeling road traffic crashes as accidents and really talking about them in the context of being crashes that are preventable. But at the time that we started understanding, started thinking about this, we really did think that they were accidents, that they were unpreventable. Of course, over the last 100 years or so, we have evolved quite a bit in terms of our understanding of road traffic crashes and specifically the modalities of injury causation. And this draws a lot from public health. And this is actually the infectious disease model that was established many decades ago. And as you can see here, the idea here is that a vector, for example, let's say it's a mosquito, carries a microorganism, and that mosquito infects a person within the environment. And for example, we know that malaria is more endemic in certain regions of the world, and that is the environment in which the vector lives, and it's through that vector that the microorganism infects the host. Similarly, as we started to think about road traffic deaths and road traffic injuries, we started to apply a similar logic to this in the sense that we recognize that road traffic crashes actually transfer, rather than a microorganism, it's really about the transfer of energy. And in this case, we're talking about kinetic energy that was transferred through a vehicle during a crash to the individual. And it's the transfer of energy that exceeds the human tolerance that actually causes an injury. So we started to think about this in the same way. So we started to be able to identify, of course, the things that actually could mitigate the transfer of energy. And this is really where we started to think about the Hadden matrix. And of course, many of you already know this. This is really where the science of systems thinking started to come in. We started to think about the person, the vector, and the environment in a more systematic way. And in addition, we started to think about the intervals. So we could prevent a crash from occurring altogether. We could mitigate the impact of a crash, and we could actually mitigate the severity of the crash or the severity of an injury after the crash occurs. And so this is really the matrix that I think started a lot of the systems thinking that we're very used to. And as you can see, here are some very simple examples of interventions that were put forward as a means, for example, of preventing a head injury during the event of a crash. The use of helmets mitigates the severity of the impact, again, mitigating the severity of the energy that's being transferred between the individual and the in this case, a person falling over and hitting the ground. And you can see, obviously, as we move along, that things such as having available emergency medical care services and increasing access to post emergency care can significantly improve the outcomes in terms of injuries. However, this really was just the starting point. Over time, and in the 2000s, we started to talk about not the Hadden matrix, but we started to talk about really the safe systems. And of course, this is really has been driven a lot by the advancements made by the Swedish government in terms of their Vision Zero and their commitment to actually not having deaths resulting from crashes. One of the important points that has been made in the safe systems that it actually is not being designed to prevent crashes from occurring. It's really being designed to ensure that even when crashes occur, that deaths or injuries are not happening. And really, this is where the pillars of the safe systems came about. And as you, many of you are already aware, in the last decade, we had a global plan that highlighted the 5 pillars that are listed here: road safety management, safer roads, safer vehicles, safer road users, as well as the importance of post-crash care. However, despite having a global plan in the last decade, and despite a better understanding of safe systems, the target to actually have the number of deaths by 2020 was not met. And I apologize, the data here only goes to 2016, but even if we go to 2020, we see that the trends have not changed. In fact, the number of road traffic deaths has remained fairly constant over the last 20 years. It's hovered around 1.2 and 1.3 million deaths annually, and the rate of deaths is the same. It's about 18 per 100,000 population. So we can see that even though we've recognized the problem, even though we've actually put in place a framework to understand and to actually intervene, globally and in many countries, we still have not met this target. So the fundamental question that all of us are here thinking about is, why have we not achieved those targets? And what should we do differently in the coming decade to change that and to ensure that the new target of actually reducing deaths by 50% by 2030 is met, and that we're not going to be in the same situation 10 years from now asking ourselves the questions why? So I'd like to actually put forward some perhaps provocative suggestions. I believe that a major part of the failure to meet the target is actually not due to an understanding of the injury mechanisms or the crash mechanisms or an understanding of how safe systems work, but it's really what I would describe as an implementation failure. And in this case, I think the approaches that we have adopted over the last decade have been too dominated by a sort of a linear thinking approach and a use of what I would describe as a risk factor-based interventions that has resulted in a fragmentation of the system. And I will speak more to this point in a little bit. I also believe that we as a global community of road safety have failed to really leverage the co-benefits of a broader development agenda and to think about how, for example, road safety links to climate change, how road safety links to sustainable development, road safety links, for example, to urban development and cities, for example. I also think that there has been a failure on our part to engage with a full range of actors, both state and non-state, in addressing the global road safety problem. What I'd like to do now is actually to propose 3 points that relate to how we might be able to apply systems thinking to improve road safety outcomes. And the first point I'd like to make is to think about how do we apply systems thinking to perhaps frame the challenge, or in this case, what I would suggest is how we may reframe the challenge. We've all heard that road traffic deaths are really just the tip of the iceberg, and you've probably seen different iterations of this. You've probably seen the events where you have 1.3 million deaths, and at the bottom of the iceberg, you've probably seen 50 million injuries. What I'm showing here is a different way of looking at road traffic deaths. And I would like to sort of walk you through briefly the idea of thinking through this in this systematic way. When we talk about road traffic deaths, we're really talking about the events that occur. This is just what happens. When we go one step below that, what we want to think about is we want to think about the patterns and trends. And this is what we're doing, for example, with the data that we have collected over the last 20 years. And I'm showing you that the trends actually haven't changed. What we haven't, I think, looked at a lot is the underlying structures in terms of what has influenced those patterns. What are the relationships between the different parts of the system? And again, here I am emphasizing the fact that although we have identified the safe systems pillars, we really haven't talked about the interaction between those parts. And we really haven't systematically tried to use that interaction to influence the types of outcomes. And of course, underlying all of these are the assumptions and the beliefs and the values that people hold about the systems. And these are the types of the values that fundamentally keep the system the way it is. So what I'm trying to show here is that, if we really want to change road safety outcomes, we have to do more than just intervene at the events level. We actually have to start thinking about the underlying structures, but also have to think about the mental models that we as a society hold that actually perpetuate these types of models. So for example, and this is really what we're talking about: deaths and injuries. We're talking about risk factors. We're talking about transport systems and policies, and of course, we're really talking about the types of values that we hold as a society. Here's a different way of looking at this, and many of you have probably looked at, seen this graph before. Of course, this is a bit of an old graph, but it basically is a cross-sectional study that shows log income in relation to the log roads number of deaths and injury deaths, basically. And the main point that you'll see here is that as countries develop, the poorest countries actually have the lowest number of road traffic deaths. And that's because there's very little motorization that occurs in these countries. And therefore, the number of deaths is quite low. And we can see that as countries gradually increase in the income, the number of deaths increase because, again, there's an increase in motorization, and that leads to greater number of deaths. But you will also see that there is a point at which the curve actually starts to change. And as incomes increase, that the number of deaths actually starts to increase. And what this suggests to me, of course, is that there is a relation between systems and the road traffic death outcomes that we're looking at. So again, it sort of reinforces the same idea about the pyramids, that it's not just about the events, and it's not enough for us to just focus on preventing the deaths from occurring at the individual level, but it's actually thinking at the systems level about how do we change this. And of course, this is really what the economists describe as a Kuznets curve, which is an inverted U, and you see the point here, where as economies develop, they increase in the number of deaths, and there's a turning point. But when we look at the data from this perspective, it's very clear to see that the issues here are systemic issues, and they're not individual issues. And so what we're now actually starting to think about as we are approaching the second decade of action for road safety, and what has really been emphasized in the new global plan, is actually thinking about a broader system of transport and mobility, and also thinking specifically about road transport and mobility, not just from a perspective of safety, but actually thinking about the other co-benefits. So for example, we know that if we have safer and cleaner transport modes, we actually improve, for example, air quality. If we reduce the number of private cars in the roads and we encourage more walking and cycling, and encourage, for example, increase public transportation, we limit the number of automobiles, we reduce the exposure, and ultimately reduce the number of deaths. But we also help to promote increased physical activity, and we actually also contribute to improved well-being. But we also know, for example, that this system is actually influenced and impacted by a number of other factors. So, obviously one of the most pressing issues right now that's current today is, of course, fuel prices, because of the geopolitical situation that we're living in. And now we're starting to see the potential impact of the geopolitical situation and the fuel prices on something like transport and mobility. We also know that issues, for example, around security also impact safety. So this idea of framing the challenge as a system actually allows us to actually understand the influences, the broader influences that impact the overall system. And of course, all underpinning all of these things are our own personal values, personal and social values, for example, about fuel prices. And our values about oil and gas and the use of natural resources impacts directly, the ultimate, the systems that we are really trying to influence. So in order for us to be able to move forward, these are the types of considerations that we must take into account as we're thinking about the system. The second point that I wanted to touch upon is this notion of using systems thinking as a means to understand causality and complexity. And that sounds a lot more complicated than it really is. Historically, I think all of us as program managers or practitioners or research, we're obviously trained to use logic models as a means of planning, but also measuring outputs and outcomes and impact. And of course, this is something that has been developed for many, many years, and it works very well for certain things, in the sense that we understand that what we put in results in output, and this helps to produce an outcome, and it helps to produce an impact. However, when we start to think about the system, and for example, to think about the system from the perspective that I just shared with you in terms of its linkages to environment, its linkages to physical activity, its linkages and the influences, for example, of oil prices on transport, it becomes much, much more complicated. And what we realize is that, this model, this assumption that outcomes and impact can be predicted based sort of on a linear model doesn't really work and doesn't really apply for road safety. And this, I think, is one of the major challenges that we have faced in terms of how we work and how we develop solutions for the global road safety problem. This is an image that I've taken. It's actually a depiction of work that was done by a mathematician in the 1970s, Edward Lorenz, and this was made very, very popular or well known. The idea that was that he was actually a mathematician and he was a meteorologist, and he was trying to predict weather patterns. And this is mislabeled because in his initial study, he talked a lot about the idea that a butterfly in Texas, flapping its wings through a multiplicative effect could actually impact weather patterns and could actually lead to, for example, a tornado in Brazil. And so the idea is that it's the chain of events is actually not linear, but actually very complex. And it's actually much more like what is depicted on the slide here, that it is not that is not linear, but it also has multiple chains of causality, and things influence each other in non-linear ways. And unless we start to recognize the non-linear sort of influences of the different components of the system, we're actually not really able to actually change the system in a way that achieves the outcomes, because we will continue to miss important elements. And I think that's actually fundamentally part of the challenge that we've had over the last decade. So, what we want to start thinking about is to look at safety in a very different way and the safe system in a slightly different way. And it's not that we are disregarding, if you will, the pillars of the safe systems. We recognize that these elements are still important. They are still relevant to the discussion today. But what we want to focus on more through a systems thinking perspective is actually to understand how they interact with each other. Rather than looking them as independent silos, we actually want to think, for example, how a pillar on safer roads might interact with a pillar on safe road use and what outcomes that produces. And so I've shown a very simple illustration here of saying that, it's not about just having a summative effect. That is, the whole of the whole is more than the sum of the parts, but we're actually seeing the interactions, and the interactions themselves create important changes that actually lead to the outcomes that we're looking for. Yellow and blue make green, red and yellow make orange, and so forth. And it's actually understanding these interactions and understanding how do we actually leverage these interactions that is critical to actually improving the safety of systems. And I will show you some very concrete examples of what this looks like. So, in May of last year, some of you may recall that the United Nations Road Safety Week, we actually focused on having a campaign around the use of 30 kilometers. The 30-kilometer speed limit. And of course, this was something that was highlighted in the Stockholm Declaration as well as an important means of achieving the goals. But you can see here, this is a 30-kilometer speed road actually it's in Ireland. And here is an example of another 30-kilometer speed limit. And this is actually taken from a city in the Netherlands, actually. And you probably recognize here the difference between the two. So it's not just about ensuring that you have safe infrastructure or having the right speed limits. It's actually thinking about how the speed limit, the laws, the legislation actually work with the environment to ensure that you're producing the type of outcome. And I think if you look at these two pictures, it's obvious which one is a more appropriate 30-kilometer speed limit and which one is more likely to work as a 30-kilometer speed limit. So really the question is, as we're moving forward, is to not only think about interventions, it's not to think about how can an intervention be scaled up within the transport or health system. It's actually to think about how can the health system be changed to deliver that outcome. And this picture, for example, is something that many of you undoubtedly have seen, and it illustrates a very simple point. A lot of people use it to talk about equity, but the point that I'd like to make here is that this is an example of a systems failure. And most of us think about the second picture as a means of achieving the outcome that we want. We are intervening. And what I'm suggesting is that we have to do more than intervene at the events level. We actually have to think about how do we change the system so that the problem doesn't exist to begin with. And really, that's really what we're talking about. I'm going to skip through some of these slides because I'm almost at the end, but what I really wanted to highlight here is that the opportunity ahead of us is really that we have an enormous private sector that engages in transport. Companies use transport services. And the idea here is that if we can actually get companies to use those investments in transport services in a way that is actually resulted in positive outcomes, we can actually contribute greatly to road safety. And the reason is, if you look here at the top, the world's 10 biggest economies, I'm not talking about companies or countries, it's just economies, economic entities. You'll see here is that Walmart is actually the world's 10th largest economy, which means that Walmart as a corporation is bigger than 183 or 84 of the UN member states, for example. So what we're trying to suggest is that there is a huge opportunity for us to engage beyond what we're doing. And really the point here is that we really do need to apply a broader systems approach to thinking about the road safety problems in terms of how we frame it, how we identify the solutions, and then how we actually engage with actors. And my final point here is that, systems thinking is really about understanding complexity and understanding the multiple perspectives. This is actually a picture that's taken from Geneva, where I live right now. And if you look at it this way, it may not be clear what it is. When you look at it from standing on to the left of the image, what you see is the word no in French. And when you look at it from standing from the right of the image, what you see is the word oui, which is yes in French. And the point that I'm making here is very simple, is that it's not very always evident what a system is. And it is very possible for systems to actually have diametrically opposing realities all in one. And part of our challenge is to be able to understand that complexity in order to be able to respond in an effective way. So let me end there, and I thank you for your attention. Thank you.
Zo, bij de Wereldgezondheidsorganisatie duurt een kwartier net iets langer, maar dankzij Nhan Tran weten we gelukkig wel dat we er niet alleen voor staan en dat het een wereldwijde ambitie is om het aantal verkeersslachtoffers terug te dringen, want dat is toch de centrale inzet van waar we mee bezig zijn. Wie beter dan Cathy Berx om jullie daarvoor te bedanken. Ze werkt als gouverneur van de provincie Antwerpen, maar in die functie is ze sinds enkele jaren ook voorzitter van het Vlaams Forum Verkeersveiligheid. En die voorzitter die mag klassiek het congres altijd afsluiten. Het laatste woord van vandaag is voor Cathy Berx.
Goedemiddag, beste deelnemers aan het Vlaams Congres Verkeersveiligheid. Voortdoen zoals we bezig zijn, is absoluut geen optie. De ongevallencijfers uit de Verkeersveiligheidsbarometer 2021 maken dat nog maar eens bijzonder pijnlijk duidelijk. De trieste cijfers kwamen vandaag al meermaals aan bod. Het aantal letselongevallen en gewonden steeg op 1 jaar tijd met maar liefst 13%. In Vlaanderen verloren 291 mensen het leven in het verkeer. Dat zijn er 45 meer dan het jaar voordien. 291 gezinnen en families die een grootouder, een ouder, een kind, een broer of zus, een vriend verloren. Door de eenvoudige reden dat ze zich verplaatsten in het verkeer. Te voet, als fietser, als motorrijder, door e-commerce, door welke reden dan ook. Met deze cijfers zijn we verder dan ooit van de doelstellingen van het verkeersveiligheidsplan. Nu, ieder verkeersslachtoffer is er 1 te veel. Daarover is iedereen het allicht en vooral hopelijk ook eens. Maar handelen we ook consequent naar die doelstelling? Een doelstelling voorop stellen, geen 0-0 slachtoffers in en door het verkeer, is verre van vrijblijven. Want het veronderstelt consequent handelen. Het veronderstelt een consequent mobiliteits- en verkeersveiligheidsbeleid. En dit op alle niveaus. En dit van alle verkeersdeelnemers. Inzicht en kennis van de vele pijnpunten helpen ons om gericht actie te ondernemen. Zo analyseerde de VSV dat meer dan de helft van de letselongevallen binnen de bebouwde kom gebeurde. Anderzijds verliezen meer verkeersdeelnemers het leven of raken ze ernstig gewond buiten de bebouwde kom. Overdreven snelheid, afleiding door het gebruik van smartphones, vermoeidheid en de grote impact ervan op de ongevallen ernst zijn zonder twijfel de belangrijkste oorzaak om rijden onder invloed niet te vergeten. 6 op 10 doden en zwaar gewonden in de bebouwde kom verplaatsen zich actief als voetganger, fietser, bromfietser of motorrijder. In de bebouwde kom zijn dus de meest actieve weggebruikers de meest kwetsbare weggebruikers. Buiten de bebouwde kom vormde het verkeer vooral voor inzittenden van personenwagens het grootste risico. Vooral het aantal doden en zwaar gewonden bij de voetgangers en fietsers baart bijzonder veel zorgen. 25% van alle verkeersdoden in de bebouwde kom waren voetgangers. Van alle zwaar gewonden en doden in de bebouwde kom verplaatsten maar liefst 8 op 10 zich te voet. En wat het zo mogelijk nog schrijnender maakt, in deze groep zijn het vooral kinderen en ouderen die oververtegenwoordigd zijn. Het raakt mij diep, en u allicht ook, dat de meest kwetsbaren, onze kinderen en senioren, het hardst worden getroffen. Bijkomende inspanningen en acties om van de bebouwde kom, om van de centra van onze steden, gemeenten en dorpen een veilige plek voor voetgangers en actieve weggebruikers te maken, dringen zich meer dan ooit op. Een consequente kindnorm bijvoorbeeld kan daarbij helpen. Want wat veilig is voor jong en oud, is dat allicht voor iedereen. De killers zijn gekend. Vele van de remedies in theorie ook. Die killers zijn gekend. Snelheid, rijden onder invloed. Welnu, snelheid verlagen betekent ook dat het risico op een ongeval systematisch en sterk afneemt. Bovendien zijn de impact, of zullen de impact en de gevolgen ook kleiner zijn wanneer het onverhoopt toch misgaat. Bij deze roep ik dan ook iedereen op om die coalitie van 30 te vervoegen. Keer de redenering gewoon om. Ga uit van 30 per uur in de bebouwde kom. En een hoger snelheidsregime kan slechts dan wanneer die weg veilig is ingericht voor voetgangers, voor fietsers, voor actieve weggebruikers. Geen conflicterende kruispunten, afgescheiden voetpaden en fietspaden. Nu, als lokale overheid kan u echt het verschil maken. En u staat daar niet alleen voor. U wordt daarbij gerugsteund door verschillende projecten die inmiddels werden opgestart. Projecten met gelijklopende ambities en doelstellingen. Zo is er het project Verkeersveilige Gemeenten, gestart in Antwerpen, maar inmiddels uitgerold in heel Vlaanderen, waar we samen met de VSV en ouders van verongelukte kinderen gemeenten ondersteunen bij het opmaken van een lokaal verkeersveiligheidsplan en uiteraard bij de implementatie ervan. Er is het Verkeersveiligheidsplan Vlaanderen, met daarin de duidelijke doelstelling om lokale besturen te ondersteunen bij het leiden van veilige verkeersstromen. En sinds kort is er het afwegingskader voor snelheidsregimes binnen de bebouwde kom van MOW, mobiliteit en openbare werken. Doel is klaar. Help lokale besturen om verantwoorde keuzes te maken. En last but not least, ik zei het al en er is terecht veel aandacht aan besteed, de genoemde coalitie van 30. Deze coalitie van de willing verenigt een groeiend aantal steden, gemeenten en gelukkig is ook provincie Antwerpen inmiddels aangesloten om overtuigd te kiezen voor 30 km per uur. Om dit in te voeren in de bebouwde kom, mogen velen dit echt willen en ook doen. De leden van de coalitie zijn wat graag bereid om u allen met raad en daad bij te staan. Zij zijn het best geplaatst om de weg te wijzen naar een lagere snelheid, minder ongevallen binnen de bebouwde kom. Lagere snelheden, 30 per uur, tenzij het anders kan, maar ook minder gemotoriseerd vervoer. Want ja, ook e-commerce draagt helaas bij tot het stijgen van het aantal slachtoffers in het verkeer. Voorzichtig rijgedrag van elke weggebruiker, ook dat maakt mee het verschil. Dames en heren, laten we dus samen dat ambitieuze doel herhalen. Herhalen. En er samen alles aan doen wat nodig is om het ook te halen. 0. Geen zero slachtoffers in en door het verkeer. Dat vele organisaties en partners zoals de VSV en ook steeds meer steden en gemeenten die ambitie delen en ook nastreven, stemt hoopvol. De cijfers tonen het aan. 291 doden in het verkeer, in Vlaanderen 45, meer dan het jaar voordien. Het is 11:55. Ik reken alvast op u allen om samen die ambitie van 0 verkeersdoden, van 0 slachtoffers in het verkeer te durven, te willen realiseren. Om die ambitie gezamenlijk te blijven uitdragen en er steeds consequent naar te handelen. Laat voor één keer wetten en praktische bezwaren niet langer tussen droom en daad staan. Dank dat ik daarvoor op u allen, op VSV, op alle lokale besturen, op allen kan rekenen. Bedankt.
Dankjewel, Cathy Berx, provinciegouverneur van Antwerpen, maar vooral ook de voorzitter van het Vlaams Forum Verkeersveiligheid, voor de motivatie, want die hebben we allemaal nodig. Ook al zijn we met z'n allen goed bezig, zo'n kleine schop onder de kont kan ons nog helpen. Zeker op het einde van deze congresdag, het Vlaams Congres Verkeersveiligheid. Ik wil u daarvoor heel graag bedanken als deelnemer voor uw inzet voor die verkeersveiligheid, want die is belangrijk. Ja, elk verschil is een verschil en kan een ander verschil in gang zetten. We zijn er nog niet, maar uw massale aanwezigheid vandaag en de vele voorbeelden van vandaag bewijzen wel dat we met z'n allen goed bezig zijn en toch in elk geval de goede richting opgaan. En we zullen permanent en doorgedreven ons moeten blijven inspannen voor die verkeersveiligheid. Dat gaan we ook doen, elke dag een stapje dichter naar een bebouwde kom waarin we ons allemaal veilig kunnen bewegen. Zoals u intussen wel weet, kan u vanaf volgende week alle sessies van dit congres herbekijken via vlaamscongresverkeersveiligheid.be. Bedankt om samen van dit Vlaams Congres Verkeersveiligheid een succes te maken. Zonder jullie overdonderende input was dit niet mogelijk. Jullie waren met honderden. We gaan op weg naar 2023, waarin we het gewoon weer fysiek doen. Enfin, daar gaan we nu toch vanuit. 21 maart 2023, laat dat al de eerste afspraak in uw agenda zijn voor 2023. Tot de volgende keer. Fijn dat u er was. Ciao.